helps people with so-called personality disorders. What are personality disorders anyway? Well, I had to learn the DSM when I was in school, and that's a diagnostic manual that psychologists and psychiatrists use to understand certain mental health conditions. And there's a lot of debate about whether that book is ridiculous or not, but nonetheless, it's what insurance accepts. It's what people use as the standard to decide all these different labels that people are given. And I don't like labels personally. I don't like grouping people into categories either. However, there are certain behaviors that people exhibit and they can be problematic for the individual. And personality disorders are groupings and clusters of behaviors that follow a certain pattern of behavior that lead to results that are not ideal for the individual. And something that these 10 personality disorders have in common is a concept called ego-syntonic. And ego-syntonic means that the people with personality disorders are operating from a position of my reality is the reality of the world. My view that I have on this certain relationship or this certain situation is also the view that everybody else has, and it's just the way things are. Now, that is, and a lot of people would agree that that's not necessarily the most functional way to view reality and to view the world, because our own beliefs, our own perspective on a situation is ours and it's valid. However, another person might have a different perspective on that same situation, or they might have a different view on the relationship that they're in with me. And if I can't understand that or understand their perspective, or even understand that there's a different perspective than mine, I'm going to have less success in my life with relationships and with worldview. So how do you get out of that? How do you snap out of an ego-syntonic position if you have a personality disorder? Well, the traditional way is a lot of therapy. And there's a concept, there's a therapeutic approach called Dialectic Behavioral Therapy, DBT. And it's the combination of Zen Buddhism with cognitive behavioral therapy. It was developed by Marsha Linehan back in the 70s. And it's a very good way to work on personality disorders, especially a personality disorder called borderline personality disorder. It works for a lot of different disorders, but that's kind of the main one that got most of the attention. And I'm a big fan of DBT. However, it requires a lot of work. It requires a big commitment. It requires group therapy, individual therapy. It requires 2 therapists, not just one. And it requires a lot of sort of focus and a lot of initiative. And it's really, really good. And all those things are healthy and productive. However, not everybody has access to that. Not everybody has the ability to do that. DBT therapy isn't available everywhere. It's very, very available in big cities and other sort of medium-sized cities, I would say. But it's just not, there's barriers to that type of care for a lot of people. So why does Rhythmia help people come out of an ego-syntonic position and then go into what is the healthier version, which is an ego-dystonic? Ego-dystonic means you understand there's different perspectives and different views, and that your worldview and your relationship view is important for you, but there's also different ideas that can come, and there's also different perspectives that you might be benefit from, and that you can see other people's viewpoints. Why does Rhythmia help you with that? Well, I'll tell you why. Because Rhythmia helps you step out of yourself and look at you. It helps you become your own therapist. It helps you analyze what's going on with you. I was working in therapy for years in Los Angeles, and I had a practice, and I was working with people all day long. And it was only to a certain point of effectiveness because I'm not that person. They are who they are. The patient is who they are. I can bring awareness, or I can bring up certain topics. I can bring some insight maybe, but I'm very limited in what I can do because it's their life, it's their perspective, it's their view. So how does somebody come out of that egocentric perspective and look ego-dystonically at themselves, is that you have to be able to step away from yourself and analyze you. And ayahuasca, the way we serve it at Rhythmia, facilitates this process. It helps you become your own therapist. It helps you realize what's triggering you, what trauma you are holding on to. It helps unlock the amygdala part of the brain, which is where we store emotional memories, and helps bring those to the prefrontal cortex, where we can process them and feel them and get rid of them and release them. It helps you see that what you're viewing in life from your one egocentric position is limited, and it helps you get outside of yourself and get more of a bigger worldview perspective. And that's the reason why this works so well for people that have, as I call them, so-called personality disorders. So the thing that always rubbed me wrong in my Western medical training was that these personality disorders are uncurable. You can treat them, but they're not curable. It's just who they are. That's it, you know? And that's like so ridiculous. It's like, how can something that's problematic be locked in to an individual? Can't somebody change? And the belief in the Western system is, no, these things cannot change. It's who you are. And I challenge that. I disagree. I believe that it can be adjusted. It can be changed. It just depends on the person's focus, and it depends on the person's work that they do. You can go into DBT therapy and do that for a year or longer, which is really good approach. Or you can kickstart the process and come to Rhythmia, and this is a week-long program. We can jumpstart you into the way that this can be helpful for you. And there's been a lot of people that have come here with personality disorders that have fixed a lot of the symptoms of it and reported having much improvement about it. So it's very encouraging as a healthcare professional to be able to see this sort of these outcome results happening for people. It's really exciting. So I would welcome all of you to come down, check this out. It's a week-long program. It's an amazing thing. We have a lot of modalities happening here. Aside from plant medicine, we have breath work, yoga. We have an amazing staff. Everybody's so cool. And Costa Rica is a beautiful country, so you can't go wrong in coming here. So I look forward to meeting everybody. Thanks for watching. See you guys next week. Dr. Jeff, pura vida.